This is where I have OCD now.
Okay.
That's fine. That's because it's not my towel. My towels get ironed. It's driving me mad. Look, they don't meet. Look.
Leave the OCD.
Okay, see? Not my size towels. Okay, now, if you are working on someone, ladies, this is a cheat. Ladies, this is a cheat for you. Come this way, sir. If it makes me feel like prison again.
And the soap.
Just don't drop the soap. If you're working with somebody who's in quite a lot of pain but is much bigger than you, do me a favour, just turn that light off, please. Otherwise I get a migraine. Perfect, thank you. You can move them if they're so much in pain they refuse to move. This is how you move them. These two fingers underneath the knees, the second knee, not this one, second one. Hold them from here. Watch. They move, no problem whatsoever. Okay, I'll just show you. Can you stand up, please? Can I borrow you? So, just lay on your side. Same thing. I'm going to use you again. Right, move all the way back to the other side. Perfect. Okay. Just turn the light off, please. Yeah. It's because it's a Samsung. If you had an iPhone, you wouldn't need it.
You have shares?
I wish. Hindsight. It's the worst word in the English language. Hindsight.
Hindsight?
Hindsight. It means if I knew then what I know now.
Okay.
Okay.
Yeah. Hindsight, I would have bought property in London and not be here. So, these two fingers. Underneath. Ready? Now I've supported my body, I've supported myself. Okay? And he's much bigger than me. No problem. Okay, thank you. The beautiful one is back. Okay, so flexion. Sorry, you've just trapped it. So, flexion. I'm going to be moving the lumbar spine this way. Now, what I can do, I don't have to use my hands if I don't want to, but it's quite nice if I hold on to, can I expose this area? Yeah? Here are the spinous processes. So if I just pull down and help round like this. Does that make sense?
Yeah.
Okay. So I need to face the way I am going.
Especially vertebra, like L4-5 or never mind?
To be honest with you, this is almost irrelevant because I'm still not going to move it.
Ah, okay.
This is we call it a gesture.
Okay.
Because I could pretty much tell the person I'm moving that one around. Okay, here, look, you see my hand is off them?
Yeah.
Forgive me, it's not this. Okay, people don't like it. Off, push down, like this. And what you do, you'll feel where he wants to move there. Okay. Then I move up one, so I need more flexion. Okay? As I move up, the more flexion I need. Does this make sense?
Yes.
Okay. So, really, this technique is nice and effective from L5 to around about L3, L2. L1, they've got to be all the way up here.
Wow.
Right. For some people, so if they have
Big belly. Yeah.
too many,
Major. Keres major we call it.
too much of this, you're not. They're just gonna feel like you're pushing their stomach up into their throat. So you can only work with the anatomy you have. Okay. So remember, this is my stance because I'm going this way. I rest their leg onto my thigh here. This is why I have the towel. Because especially here, I don't want them feeling stuff. Like that. And I'm going like this. So I can take my hands away and it can still have the same effect if I need to. Okay? Like that, here. Nice and easy. Keep the legs down. You see how the legs are just being kept onto the table? If you try and hold the legs up here,
Heavy.
it's heavy, especially like women or men trying to hold the legs up here, you're going to last a minute. The legs become very heavy. So that's flexion. Now extension, we turn. We're going this way.
Wait, why we want to do a PTT?
So what do I do?
Why to make this?
PPT.
Posterior pelvic tilt.
The pelvis tilt is irrelevant right now.
הוא דיבר על פלקס של הגב, זה לא נראה.
כן, אבל אם יש לחץ של העצב,
Sorry?
אנחנו לא רוצים לקחת.
Direction of where you put your hands, your fingers.
אבל הוא לא מדבר עכשיו על
Yes, spinous process.
הוא מדבר על...
No, I'm following it round. I'm guiding it round.
Into as if posterior pelvic tilt.
Yes.
נניח שיש לך פריצת דיסק.
Okay, so what's the pelvis got to do with it right now?
No.
What's the discussion?
Nothing. All okay. It's all about the movement of the cerebellum.
You ask
Yes.
why to do the flexion.
Yeah.
In process, I'm underneath the second knee. Look, I'm facing the way I'm going. This time, I push on to the spinous process, and sorry, ma'am. Can we take them off? Good. Perfect.
But don't take them home.
We all have. See, look. Not my towel. All over my trousers.
Dry cleaning after the...
Actually, yeah.
Couldn't find a dry cleaner.
Couldn't find a dry cleaners. What is a dry cleaners in Hebrew? Because
יבש.
Don't do.
There is a lot. Listen. Put the app that calls easy cleaning.
okay, tell me at lunchtime.
Okay, and you will find everything.
Okay.
Close.
כמה תרים, עברתי מזה,
Listen, I just went in there to see a movie. Right. So extension. So I'm pushing the knees away from them, and I'm gently pushing this way to just create a little bit more.
But this is enough.
Yes, enough. You'll feel it move.
Only to move the cerebellum.
It's only to move it. That's it. Look, you can do it. She's moving.
That the fluid will move inside.
Yeah.
Now you're under my spine, right?
No, on the top.
On the
I'm
top?
pushing this way.
Not under
No,
the ground.
no.
Under the
On it. Okay? So there's the extension. Okay? Are we happy with this?
Yeah.
Right. Because what I'm showing them individual, and then I'm going to mix them all together.
Okay.
Okay, so we've done flexion, extension. Now we're going to do side bending.
Okay.
So lateral flexion. So, you need to hold just above the malleolus. I've still got her legs on my knee because that's now a fulcrum, it's a pivot point.
Yeah.
And then, so if I do this,
You're back.
which side am I bending?
The left side.
The right side.
Which side is she side bending?
You are straight
This
to
is
the
left
right
side.
and
Left side.
Left side.
bending the right.
She's side bending left.
She's stretching the right side.
Don't worry about the right side right now.
She's bending
She doesn't
left.
have a right side.
Okay.
Just wrong.
Yeah? So we're side bending her left now. What we do is, it's up to you. You can have the thumb. So the thumb is on the side of you.
On the upper
This side.
On the
Same
upper-
side. Yeah? You can do this.
On the side it's flexing.
That's it. This. It's up to you.
It's not matter.
Doesn't matter. I like this. This is like dun, 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 dun. Okay? And from here, look how straight I am. Look. That's it. And the higher I come, the more I've got to move. But what is the limiting factor here?
When did she say that?
Her hips.
Yeah. Be
40
careful.
degrees, no?
If she can't do any further, you can't go.
But sometimes if you not fix the angle of the hips, you cannot even do this.
Exactly. So you've got to work with what you have.
Yeah, but it can be done to fix the angle of the hip.
Explain what you mean.
Some people
Stabilize, like,
cannot do all the movement in the hip
Right?
because it's stuck to them of many reasons. Okay?
That's true. So for example, if I did this, but if they can't do it on this leg, I can make this straighter, like this.
Yeah. And this is the angle
That
that's
involves
stuck
the
all the
hip.
time.
They can't do any much
Yeah,
more
this
than
is
that.
this is the angle
But
that's
that
stuck all
involves
the
the
time.
hip
Most of
more
the people.
so.
Yes, it does. Yeah. You're working with what you have.
But most of it becomes because of the pelvis that it's tilt or something, and if you release it a little bit, you have more angle. No, leave it. Leave it.
Can of worms.
It's my biomechanic. Leave it.
Can of worms.
The
Okay?
knee could be also a limiting factor.
What's that?
The knee could be
Yeah,
also
absolutely.
a limiting factor.
Absolutely. You are working.
The question is, if the knee, let's say, is a limiting factor,
Yeah.
different like your get the side flexion and not have the
No.
knee in the way.
No, you'd have to end up doing this.
Which we're gonna do in a minute. We're gonna end up
כן,
Yeah, this side, that side bend.
Oh, you go from that.
Yeah? One discussion. One, otherwise people lose track. Yeah? There are many alterations that you can make. Many. This is the start. This is the basic start. If they cannot bring their hips here, you could start here. But you are again limited because the more I then straighten her body, the lower the effect at her lumbar spine. You compromise something at each technique. Ideally, they should be here, 90 degrees. That way, you're going to get maximum movement in the lumbar spine. Okay? If they can't, readjust. This is side bending left. Side bending right. You move your hand to underneath.
Okay.
And what you do is you lean forwards. Okay? Like this. This is doing nothing. This just tells the person how far you're going down. Gives you, what's that? This feels nice. So you go like this and like this.
You
Like
pump
this.
water.
Like this. Look. Both sides. Not necessarily, because they may not be able to lay on this side. Okay? Yeah? Like this. I'm just switching my hands. That's all I'm doing. Okay? Then I can move to flexion. And look, there's a tiny bit of extension there already. Flexion. Side bending. Extension. And the small amount of rotation. How many degrees of rotation on each lumbar spine segment? At each level, how much rotation? 1 degree. So you're going to do this. That's it. So what I'm doing is I'm stopping and I'm pushing on the hip. That's it.
Okay. Only
Actually,
only 1 degree?
only per... So you're 5 degrees in total. When you do this, it's all from your thoracic spine.
Okay.
That's why somebody comes in with pain here, we crack this. Okay? They come in for pain here, we crack this. Because this is all the movement. Yeah? So, flexion, extension, side bending, bit of rotation, go.